Imagine you're sitting around a campfire with your friends, and the topic of comas comes up. You lean in, your face illuminated by the flickering flames, and begin to explain. A coma is like the deepest sleep you can imagine, but one you can't wake up from. It's a state of profound unconsciousness, where a person is completely unresponsive to the world around them. Picture someone lying still, eyes closed, oblivious to light, sound, or even pain. They're not just asleep. Their brain has essentially shut down most of its higher functions. Now, here's where it gets interesting. In a coma, the brain's basic functions like breathing and circulation are still working, but the parts responsible for awareness and wakefulness are severely impaired. It's as if the brain's power switch has been turned way down, but not completely off. Comas can happen for various reasons. Sometimes it's due to a severe head injury, other times it might be because of a stroke, drug overdose, or even extreme changes in blood sugar levels. The duration can vary too. It might last a few days, or in rare cases, even years. One of the fascinating things about comas is that even though the person appears completely unaware, there's evidence that some level of processing might still be happening in their brain. Studies have shown that comatose patients with intact temporal lobes, that's the part of the brain involved in processing sensory input and memory, might still be doing some semantic processing. It's like their brain is still trying to make sense of information, even if they can't respond to it. Doctors use something called the Glasgow Coma scale to assess how deep a coma is. They look at things like whether the person's eyes open, if they make any sounds, or if they move in response to stimuli. The lower the score, the deeper the coma. It's important to note that a coma is different from other states of altered consciousness. For instance, it's not the same as a vegetative state, where a person might have sleep-wake cycles but still lack awareness. And it's definitely not the same as brain death, where all brain activity has ceased. Recovery from a coma can be a complex process. Some people might wake up relatively quickly with minimal lasting effects, while others might transition through various states of consciousness before fully recovering. And sadly, some never fully regain consciousness. The human brain is incredibly resilient, but also delicate. A coma represents one of the most profound disruptions to our conscious experience, and it continues to be an area of intense scientific study and medical management. The brain's response differs significantly between coma and persistent vegetative state (PVS) in several key ways. Level of wakefulness. In a coma, patients show no signs of wakefulness or awareness. Their eyes remain closed and they do not respond to external stimuli. In contrast, PVS patients exhibit some level of wakefulness, including eye-opening, sleep-wake cycles, and spontaneous body movements, despite lacking awareness. Brain stem function. Coma often involves impairment of brain stem functions, which may require ventilator support for breathing. In PVS, basic brain stem functions like breathing and circulation typically remain intact. Duration. Coma is usually a temporary state lasting a few days to a few weeks. PVS, on the other hand, can persist for much longer periods, sometimes years or even decades. Transition. Coma may evolve into other states of consciousness. If a coma lasts for several weeks, it may transition into a persistent vegetative state. Brain activity patterns. While both conditions involve severe impairment of higher brain functions, PVS patients may show some level of brain processing. Studies have indicated that PVS patients with intact temporal lobes might still engage in some semantic processing, even if they can't respond. Response to stimuli. Comatose patients are completely unresponsive to all stimuli, including pain. PVS patients, while still unaware, may exhibit reflex responses to stimuli, such as eye movements or grimacing. Potential for recovery. The chances and nature of recovery differ between the two states. Patients can often emerge from a coma, though the outcome depends on the cause and severity of the brain injury. Recovery from PVS is possible but less common, especially after prolonged periods. It's important to note that distinguishing between these states can be challenging, and misdiagnosis is not uncommon. Advanced diagnostic techniques like functional MRI, quantitative EEG, and event-related potentials are being used to more accurately differentiate between various disorders of consciousness.